Okay. Awesome. So thanks everybody for your patience as we dealt with that technical difficulty. My name is Nicole Bahina, and I'm with All Chicago, and I'm really glad to be with you here today. And today is a continuation of the series we've been doing related to COVID-19 and the Homeless Service Division in the Continuum of Care, put on by All Chicago, DFSS, and CDPH. By now you probably have these memorized, but the key takeaways are that I put everybody on mute just so we reduce background noise, but I think you might have the ability to unmute yourself. So just be cognizant of that and try not to click that button so that everyone can have an enjoyable webinar experience. And then we funnel everything into the chat. So we're going to use the chat for technical issues that you're having. We're going to use the chat for questions, for responses throughout the session today, and we'll pause at various points to make sure we can answer any questions. And then what we try to do is anything we can't get to, we try to bring back for the next time or post via answers on Slack or via emails that go out after the fact. So for today's webinar, DFSS and CDPH are going to be updating everyone on the city's COVID-19 response for people experiencing homelessness, and then I'll be providing some updates about the COC and the COC implementation structure, also known as the action agenda. Then we're going to walk through some questions for you about how we want to use this time together going forward, and then we'll end with a reminder about our commitment and next steps. And just as a reminder, there have been many critical and complementary pieces of the COVID response for the homeless population. And on these webinars, we've really tried to share out any updates on the larger strategy as much as possible. And in earlier webinars, many of these strategies were new and evolving, like shielding high-risk clients and targeting testing, but our community has made a lot of progress towards adopting these responses as part of our ongoing work. So just as we've mentioned in recent webinars, we want to begin transitioning from using this webinar to just share updates and raise questions on our COVID response to really using this webinar to engage with each other around what it means to move into recovery and reopening. And so today we will again provide these key updates about what we're doing at CDPH, DFSS, and All Chicago, but it's an important reminder that within each of these buckets, we'll be asking for your input about how we can, again, use this time together moving forward and really make sure that your voice as providers comes through. And I'll mention a little more later that these webinars won't be the only opportunity for you to raise concerns and issues. We're trying to build in some other ways to get this information as a community as well. And with that, I'll turn it over to Dr. Jasmine to provide some updates. And Dr. Jasmine, I think if you're speaking, you might be on mute. Oh boy, we may have reached the end of our ability to use pre-conference call. We might be switching to a new technology because I feel like this is not working today. So she's unable to unmute herself. Let me just see. And Dr. Jasmine, can you put in the chat? You just called, or you're using your audio via your computer as well, right? Okay. It's really weird. I'm not able to unmute you as well. Dr. Jasmine, would you try disconnecting and try reconnecting again? And I'll move forward more if it's okay. I'll move forward to DFSS's section, and then we can come back to Dr. Jasmine when it's time. I think the issue that we're having, everybody, just in case it's interesting, is pre-conference switched the way that they allow webinars to happen, and they basically default to everybody being unmuted, and so I had to put us in lecture mode to avoid background noise, but now it seems like it's causing other issues. So my apologies. All right, so Dr. Jasmine, log back out, log back in. We'll see if we can unmute you, and then let me just flip forward a few slides here. Okay, so Maura, if it's okay, are you ready to go through these slides?
Sure. Good afternoon, everyone. This is Maura McCauley from the Chicago Department of Family and Support Services and our Homeless Division. So DFSS is continuing to support the decompression of the shelter system by operating temporary shelter facilities along with some of our delegate agency partners. There are currently 4 facilities in operation. One update since our last webinar is that DFSS and our partners at the temporary shelter serving youth, La Casa Norte, were able to transition young people back to La Casa Norte facilities. So they reopened their shelters and we closed the McCormick YMCA for the youth temporary shelter. That transition went smoothly. Young people were transitioned either back to La Casa Norte or to available youth beds in our existing shelter system. We will continue working with our youth partners to monitor and make sure that existing youth shelter capacity is able to meet the need going forward. We still see the need for continued decompression, and we are working to continue to support this going forward. We will continue to keep shelters and the broader community informed. No changes will be happening overnight, and all decisions will be made in coordination with CDPH and our shelter partners, so more to come on that. We are also continuing the shielding efforts between all of our shelter partners and the city, CDPH, and Lawndale Christian Health Center. So to date, approximately 170 clients at high risk for complications from COVID have been relocated from congregate shelters into individual hotel rooms for shielding. And I know Nicole will be talking about the exciting developments of beginning to move those residents into permanent housing through the Expedited Housing Initiative, which we're really thrilled is beginning. Next slide. So as in Dr. Jasmine's presentation, she's going to give a little bit more detail about the tailored guidance for shelters on public health measures as the city reopens. But over the past 2 weeks, when we were on pause from this webinar schedule, DFSS and CDPH have been in conversation with shelters on evolving public health recommendations specific to shelters as the city reopens. So I want to, again, thank all of our shelter providers who've been at the table with us to talk through what works in practice and to share creative solutions. Dr. Jasmine, hopefully, as she gets connected to audio, will be sharing a quick overview of the recommendations that we discussed with the shelters last Friday. And then if you're more interested in more detailed slides from that report out are posted on the COC Slack channel. And I really want to suggest you go and check those out if you haven't. 4 or 5 of our shelter partners presented on the best practices that they're implementing. And it was I thought it was a very dynamic presentation and a lot of good information there. So please check that out if you have not done so already. Next slide. We are continuing outreach with a specific focus on COVID education and support. DFSS is working with CDPH, our outreach partners, and our testing partners to begin conducting testing in encampments and to offer clients access to shelter and isolation facilities if needed. So we had our first testing event about 2 weeks ago. That went smoothly, and we were really pleased that no positive cases were found. Testing will continue. There will be our next testing effort will happen on Monday. So our outreach teams are currently engaging with the 2 locations ahead of this testing to let them know what's coming. So thanks to our Featherfist Night Owl partners for getting the word out, and our DFSS HOP team, and then Haymarket Outreach will also be with us on Monday for this event. So it's a real nice addition to our current coordinated outreach efforts. We'll
Great.
continue to provide
Oh, I'm sorry, Maura. I was just going to say, I think before we move on to the substantial amendment slide, it seems like I might be able to find Dr. Jasmine again here. She's called back in. Okay,
Hi,
Dr. Jasmine, I'm so sorry about that. Welcome back.
Okay, perfect.
Great. Okay, here we go.
Let me fix my screen. Okay, yes. So thank you, everyone, for making it to this meeting this week. I'll start the way I usually start is with how the current status is of COVID-19 in the city. And this sheet or this information can be found on our website, on the coronavirus website. It shows that there were 48,725 cases of COVID-19 and 2,313 deaths among Chicago since we began tracking the COVID-19 cases here. This is an increase of 140 cases and 7 deaths since June 9th. This information is from the 10th. If you look on the right, you'll see the curve. I don't know if anyone else can see it, but there is a slowing down of the acceleration, what we call flattening of the curve. And if we go on to the next slide, it'll be more apparent by what we mean by flattening of the curve. If you look on the right side of this slide, you'll see that the slope or how the doubling time is increasing as we move on in time. So in the beginning of the outbreak, we had a doubling that was occurring every 2 days. Every 4 days, it slowed down every 7 days. Right now, we're having a doubling time for every 50 days. And I think this version of the curve, you can actually see the flattening effect a lot easier. On the left side of the slide, it talks about one of the criteria that was used to decide on whether or not we should be moving to phase 3 as a city in terms of reopening was the % positivity rate. And that is calculated by the number of positive tests out of the total number of tests performed for a particular day. And as you can see with the blue line, the % positives is decreasing. What we would like in our city is for, in the general community, for it to be less than 15% positivity rate. In congregate settings, the goal, or long-term care settings, the goal is a little bit higher. It's about 30%. Because we know the great majority of the cases of COVID really has impacted these long-term care facilities. So that's why there are 2 different positivity rates. If we compare the positivity rates between the benchmark Chicago uses compared to the one for Illinois State has a general positivity rate of 20%, but we distinguish between community and long-term care facilities. The gray shadowing, it tells you the total number of tests. And what's a bit of a good news is that our positivity rate over the past week, all the way on the right side, you see that the number of tests has decreased over the past week because a lot of the centers, the testing centers, the state and the city ones, they were closed during this period of unrest. And despite us performing fewer tests, we are seeing that the positivity rate is decreasing. That's a good sign because another way to sort of, that we could see a decrease in positivity rate is by increasing the number of tests performed. So just like how basic algebra, if you increase the denominator and the numerator stays somewhat steady, the percentage actually decreases. But in our case, we see that despite the shrinking of the denominator, we're still seeing a decrease in cases. On the bottom, there's a box monitoring rates of COVID-19 in shelters. So this is a review. We've gone over this in previous webinars, but it is included here to show that initially when we started testing shelters, the clients in the shelters and staff, we saw that the initial sites that were tested had a large number of people who were positive, up to 50%. And over time, due to the infection control practices and rapidly moving the high-risk negatives into shielding housing, and the diligence that you have made in screening your staff members as well, we've seen subsequent testing sites have had lower percentages of those who are positive. This information you see is up until May 10th. I know this weekend the testing team, they're going to be reviewing and summarizing the information for all the tests that have been done to the 10th. But overall, it's been less than 5% positivity rate, but we'll include that next week. Next slide. Okay, and so here, as we discussed last week, there were three main ideas that we talked about what it would mean to move for shelters to be in phase 3. A lot of the things have been implemented already during the shelter in place, and there were some new concepts introduced. But the three main priorities are reducing the spread of COVID-19 in the shelters, minimizing the risk of COVID-19 introductions from residents and staff, and then mitigating the severity of COVID-19 in individuals. Can you go on to the next slide? And then here, highlights from last week. It was an excellent presentation from Dr. Isaac Chennai. If you missed the presentation last week, I do urge you to go back and view the recording. It was very informative. So the 4 main areas for health recommendations included reinforcing the current infection control practices. So things we already are familiar with and things that we are doing is second nature by now. So encouraging physical distancing, hand washing regularly, regular cleaning, wearing facial coverings, and screening the resident and staff members on a regular basis. And then if an individual is symptomatic, to isolate them. Okay, so this number 1 area is the most important, that we believe is the most important aspect of controlling the spread of COVID-19. The new concept that was introduced, the key takeaway that was a new concept from last week was this idea of developing a cohort or different cohorts within the shelters. So what that means is for the clients within the shelter system, you would organize them into smaller groups. Their quote-unquote family, and basically that cohort would carry out most activities together. And so within the cohort, you would implement social distancing, but the key with this concept is to limit the contact between each cohort. And so the idea for this is that if anyone were to become symptomatic, we'd have a ready-made list of close contacts that we would focus on. We've heard that the health department is trying to grow its contact tracing team. We know we test the close contacts to see if they were positive, and we'd also quarantine the close contacts to see if they would develop symptoms or later test positive within the 14 days of contact. Number 3, we have early detection and prevention. And so because we do have community spread of COVID-19, and there will be some easing and allowing some individuals to enter and leave the shelters, or if you're introducing new shelter clients, you should expect that new infections would occur. We try to mitigate that by screening new clients, screening the staff members who return, really encouraging social distancing, providing visual reminders of, for everyone to remain socially distant, to continue practicing infection control. So these are our top 3 areas where we can control or limit the spread. And the next bullet talks about how testing is useful, but does not, it's not the end-all, be-all, because what the test tells you is someone's status for that particular point in time. So if someone was exposed to COVID-19 yesterday and then presents to a shelter today, they can test negative, but later on they may test positive because it takes a few days for the amount of virus to build up in your system for the test to actually detect the virus. And then another aspect is the prevention aspect, is to focus on high-risk individuals. So what that means is those who have underlying health conditions and are over a certain age, we want to shield them as much as possible from contracting COVID-19 because we know that's the group that would have severe illness. They have a higher chance of requiring either hospitalization, or if they're hospitalized, requiring for them to be in the ICU, intensive care unit, which may lead to them, or they're in the ICU because they may need ventilation support, and we're trying to avoid that. Next slide. So there are a few of you on this call whose shelters have already gone through this process. So this talks about the testing strategies with shelters, and it's not just the Chicago Department of Public Health. We are in partnership with actual healthcare organizations. You're familiar with these, Rush, UIC, Lawndale Christian. They help organize the testing, and they provide support in terms of returning the test results or implementing or guiding you with implementing infection control practices. The test, it takes about 48 hours for the result to return. There have been times where it might have taken 3 or 4 days, but I think for the most part is roughly 48 hours. So for special testing that's being done by Lawndale Christian Health Center, it's best used for those who are currently symptomatic, and is less efficient for widespread testing. So the rapid testing, you get the results within 15 minutes, but it's still undergoing the process of becoming FDA approved. And if someone's not symptomatic, it's not as reliable. For aggregate settings, the clients and staff, both symptomatic and asymptomatic, if we know that there's an outbreak in a center, they're all tested. COVID-positive individuals were moved into isolation. So if a shelter was able to designate an area for isolation, the positive individuals were able to remain in place. If not, we found an isolation facility for them to complete their isolation period. We had nurses, so either they were nurses affiliated with one of the university systems above or through CDPH. We've hired some nurses to go and review the guidance that we provided to all shelters, just to make sure that it can be implemented at your particular setting. And if anything needed to be customized, that was the time to allow for customization. And then once the testing occurred, we would send our nurses back to review the results with the shelter, and then also help with the process of writing the referrals to the isolation facility if the clients needed to be. By now, staff should be familiar who've undergone the testing within their shelters. The staff should be familiar with how to write a referral, but if for any reason the testing needs to occur at a particular shelter, again, our nurses are available to provide reminders on how to make the referral. And now we're also began testing encampments. Some preliminary results show that is very few people testing positive. I know there was another push this week. We're awaiting results. And then we're also exploring ways to build in-house testing capacity at shelters. Right now, we're in the preliminary stages of planning for that. But just wanted to share this information. It's new from last week. And we're still trying to find ways in which this would work. So with our university affiliates or FQHCs and neighborhood health centers, will providers be the ones conducting the test, or will we be training certain shelter staff members to run the test? We're still planning for that. All the testing data is available on the web page that's listed below, and you can check. It's probably from May 10th up until May 10th, but it will be updated soon. And then on the right, this is another reminder: if you do experience, we are defining clusters to more cases within a center. You can click on that link, travelhome.org/COVID-19, and you could report those cases, and that triggers this outbreak response team to come to your center. Okay, next slide. Here we do have testing centers. On the left are the testing centers that are sponsored by the Chicago Department of Public Health. These are free to anyone who is interested in testing. You don't need to be symptomatic. You could be asymptomatic. They're both available as a walk-up or drive-through. What we encourage is for you to pre-register on chicagocovidtesting.com. However, if you're not able to pre-register, that's okay. Walk-ins are accepted. The testing is Monday through Friday between 10 a.m. and 4 p.m. On the right side, this is the website through the Illinois Department of Public Health. If you use the search feature, you could put in your address and then find the closest testing center that's near you. What I would advise too is once you discover which testing center is closest to you, you would need to call them just to verify that you're able to go. There are some that have restrictions on, such as you need to be a current patient of the facility before you can go in for testing. For the most part, most of them do allow people who aren't current patients, but because there are a few of them, we do ask that you double check before you simply walk in. Next slide. Here, we know it's been a very stressful time, both with the impact of COVID-19 on the city and all the changes that have resulted because of COVID-19, and then also because of this civil unrest that we're experiencing. The city is providing free wellness, self-care resources. If you go onto the website, you can go to the coronavirus website, and it's in partnership with 10% Happier. But the actual application is called Windy City Wellness, and it provides you with on how to relax, practice mindfulness, and gives you some meditation exercises. There are also some motivational talks and also guided meditation activities for you. I tried the sleep support. I found it helpful. So it's used by everyone across Chicago, including City of Chicago employees. Next slide. Here we have additional mental health resources. A lot of them are free. So there are some assessments that you can take and can help connect you with resources to help manage depending on your severity of stress or anxiety. We have mental health professionals available for you if you call the phone number listed here. You would see that you'd be linked to one of our therapists or caseworkers in one of the city's mental health clinics. This is all free. We know that the need is there, and we want to provide it and be there as much as possible. For those who aren't interested in a telephonic or a telehealth visit, there are other virtual support groups that you can use. They are more nationwide, but if you look onto the right side of the page, there are various organizations that will help gather people to help to work through this period of anxiety and stress. There are other therapists available outside the City of Chicago's mental health system. If you look at the bottom right, there are some lines there that connect you to those services. And then there are additional self-care resources on the left side of the page, specifically for managing stress and anxiety, sleep support, staying active, and then recovery as well. Next. So thank you, and I'm glad to stay and answer any questions you have.
Great, thanks, Dr. Jasmine. Maura, I've been trying to follow the chat through an app on my phone because I can't see it while I'm sharing my screen, but I don't think there are any questions. Is that right?
Yes, I don't see any questions either. Jennifer has been posting some links for the things that Dr. Jasmine has been talking about, but no questions.
Great.
And I also want to thank it was Primo Center, Olive Branch Mission, Franciscan Outreach, and Greenhouse Shelter. They were the ones who shared how they implemented some of the infection control practices. I encourage other centers or shelters to share with us. We're glad to allow you to share this with all your fellow shelters in the city.
Okay, thanks. So bear with me while I get forward a few slides. I think Maura's going to talk about the substantial amendment to the comp plan, and then I'll jump into some action agenda items.
Okay, great. So on Wednesday, the city released a substantial amendment to the 2020 and to 2024 Consolidated Plan, which allocates CARES Act funding specifically from CDBG, ESG, and HOPWA. Public comments are currently open and will be accepted through June 15th, 2020. And so there was a public hearing this morning. If you didn't get a chance to participate and you'd like to give comments, please do so through the email address on this slide. I also want to note that there was additional CARES Act funding that was approved through the budget ordinance that went to City Council this week. So it's not reflected in the consolidated plan because it's not a HUD funding source. So just want to share that information with this group as well. There's an additional $8.5 million from CSBG CARES Act funding that is allocated. Chicago gets an allocation from the state of Illinois. And so if you didn't see that in the full package, wanted to make sure people were aware of that. So there's additional funding for rental support and for homeless shelters in that funding package, which brings the total homeless services funding request through CARES Act to about $39.6 million. We are, again, looking for comments and thank the COC and other partners for submitting recommendations. You know, as DFSS was developing recommendations to put forth, we've always philosophically been in support of the recommendations that we're hearing. There were a lot of recommendations for housing, and we know that is very critical to ending homelessness, but also keeping vulnerable residents experiencing homelessness safe from COVID. But we also are balancing that with the need to continue supporting our shelter network during this time with some of the critical recommendations that CDPH has been talking about and that we've been working on. So just, you know, DFSS homeless team has been factoring in all of the information that we are, you know, aware of and working through with all of our partners. This is round one. We also learned this week that Chicago will be getting an additional $30 million for emergency solutions grants. And I know the COC will be thinking through recommendations for that, and we'll look forward to hearing your feedback about how those funds should be used for round two. But please provide comments if you haven't done so for the ESG and CDBG funds and HOPWA funds that are covered under the Consolidated plan. And I will pass it over to Nicole for updates.
Great, thanks. So I'm going to talk through some of the COC implementation structure or quote-unquote action agenda items. And I want to make a note. I think this might be the first public time we're talking about the way we're starting to brand the action agenda. And so I think for a lot of people it'll always be the action agenda, but because the action agenda in its original form was meant to be sort of a time-limited test, and now that this is the way that we do work as a continuum of care, we're calling it the COC implementation structure. So there'll probably be a period for a while where we're calling it both things just to help people transition the language. And then the chart here is just, it's the same chart that you've always been seeing on these webinars. I personally feel like it's really important that everybody understand what the action agenda is and that we're all working towards the same goals that are set by this, COC implementation structure, guided by the strategies that are set at the COC Board of Directors level. The only difference that you'll see in the chart here is that just the way I'm thinking about it is that there are supporting lines of action shown in red here and then priority lines of action. And the supporting lines of action are just those that kind of cross all of the priority areas and really derive their work from the priority lines of action. So it's not really changing anything about the way that they operate. But as you're starting to think about whether you're involved or how you're involved, if you're someone that's more interested in really helping think big, think new ideas, do a lot of sort of new activities, maybe try to find a place for yourself in the priority lines of action. If you are like me, like process and really want to help support sort of the big vision of things, then a supporting line of action might be a good place for you to fit in. And so I'll talk through a little bit more about what's on the horizon, or at least what are some of the key types of things that get that happen through the COC implementation structure. But to join a line of action, you can go to the website that we have dedicated to the COC work structure, and Jennifer can drop a link to that in the chat box. But we really do want people to get involved if you're not already. So these are the types of things that typically happen within the implementation structure, and some of these things we've already shared with this group, but the Coordinated Entry System Leadership Team adopted a temporary prioritization plan to help support the city's COVID-19 response. HMIS has been implemented in expanding shelter and shield hotel sites, and they also established an HMIS evaluation committee to evaluate All Chicago's performance as the HMIS lead. The COC board is going to be holding its next meeting virtually on June 17th, so just make a note about that, and you can find materials and register to listen in on All Chicago's website. We keep an events calendar there for all continuum of care activities. And then the system funding work group did submit recommendations for allocating the CARES Act funding. That's what Maura mentioned before, and so this is an area that is really active right now in the continuum of care and looking at what our continuum needs in terms of the funding that's coming, and DFSS really took those recommendations into account, and you can see that by what is in the proposed con-plan amendment. As Maura mentioned, an additional $30 million will be coming to Chicago through the Emergency Solutions Grant, and so this group of system funding work group will continue to be active in helping make recommendations pretty quickly about that. I also wanted to announce that Charisma Wilson is our new communications lead. She's our communications program manager at All Chicago. She is the primary person who does all of the communications on behalf of the COC, in addition to her other duties that she has at All Chicago. But we do have a communications line of action, and so if you're interested in joining that, you can go to our website, and that'll link to her so that you can join that. She's going to be scheduling a meeting soon. So that's been on hold just for a little bit while the position was open, but we're really, really looking forward to getting that line of action back up and running. And then I kind of prefaced this at the start of the webinar today, but we are going to be helping to facilitate focus groups and issuing a COC-wide survey, and that's going to be coming soon because I think it's been about a year and a half maybe since we've done this, but we want to get feedback on the action agenda priorities, on the lines of action, and the processes that we're using to kind of do this implementation structure for the COC. And also that's where I think some of these recovery and reopening terms, we can get really concrete in what that means. And the way that the implementation structure was built is that we can start new lines of action or sunset those that are no longer priorities. We can kind of reprioritize as a community based on things that are happening. And so we'll be, running a process to sort of collect all that feedback and then coming back to the group as a community to figure out what that means going forward. So it's just a little sneak peek about what we're doing there, and we are working with both SPC and we will be working with LEC to help shape those focus groups on the survey as well. Okay, so a couple of items on the Expedited Housing Initiative. One of the main priorities right now of the COC implementation structure is to focus on this Expedited Housing Initiative and help start to do these accelerated move-in events. That term might be new, but it's really just how we've been talking about the Expedited Housing Initiative in the past. So just as a reminder, the Expedited Housing Initiative is the way that we're helping all housing programs in the COC house people more quickly than ever before. And then a program area within the Expedited Housing Expedited Housing Initiative is these accelerated moving events that are coordinated by All Chicago in conjunction with CSH and our housing navigator and rapid rehousing partners. And I'll show you in a little bit sort of a high-level flow of what an accelerated moving event process looks like. But before we get there, just a couple of notes about that. So we're starting at Hotel 166 this week, which is a COVID-19 shielding site for people that are at high risk due to COVID-19. And we're identifying cohorts of those folks who are moving into quote-unquote bridge units. They can stay there for up to 2 years based on the funding source, and they'll be coupled with case management services. So it's a lot like a rapid rehousing experience for those people. And the city has also funded additional community-based mental health support for people who are leaving Hotel 166 and moving into these bridge units. So what the accelerated moving event process has been looking like, again, it'll probably evolve as we learn how it's going, and we don't have the full resources to do this at a large scale, but we do have enough resources to start moving small cohorts of about 20 to 30 people in over the next couple of weeks. So before we go on site for the moving event day, we complete these pre-accelerated moving event activities. So we identify the cohort of people that are going to move, or we help them complete their housing documentation, and often this is the housing system navigators who are dedicated to the system to help do this process. So they're going on site or meeting with people via phone to help get all of the documentation items in order, and then we're also doing some HMIS data entry. Then in the middle here, we go on site for a moving day, and it's a moving event day. They're not actually moving that day, but this is where we orient people to what this experience is going to look like. We help them view virtual units. So we have videos and help people understand where in the community they're located, how close they are to amenities like grocery stores and transportation. We help them complete all of the paperwork that hasn't already been completed to apply for that unit and complete the background check if that's a requirement. We help them select furniture and schedule delivery, and then also starting an assessment for an income and employment-based intervention. And then after that day is when we're rapidly trying to help people approve the unit, do the lease signing, coordinate utilities, confirm furniture delivery, move in, and then hand off to the rapid rehousing case manager. So this work is being coordinated by All Chicago, and in a lot of cases we actually have staff on site helping to do all of this work, and like I said, we're also utilizing the housing system navigation folks before we hand off to the rapid rehousing case manager. So what's next is in relation to these two things. So as part of the Expedited Housing Initiative, the COC, through our COC implementation structure and the right group, I think it was SPEC, so the System Performance and Evaluation Committee, created an accountability plan for permanent housing providers. And this information can be used as part of COC funding priorities in the future. And then All Chicago and CSH are tracking more closely than ever before each issue that is slowing down a housing placement. And we are troubleshooting live in the moment, like day by day, you know, as much as possible to help expedite housing placements. So we're hoping that this has an impact. We're hoping that it improves communication between what are often just, you know, parties that are busy and are working on a lot of things together, or not together, and then if we bring them together to work on this issue, it's just helping people reprioritize. So that might be us calling CHA and getting them on the phone with the agency that's having some issues to try to figure out what's the holdup in the process, as an example. And then we anticipate growing these accelerated moving events significantly starting later in the summer. And these are hopefully with some of the CARES Act funding that's in the CON plan. And if we're funded, as is proposed right now, this would include a significant increase in rapid rehousing and housing system navigation capacity within the COC. So stay tuned for more information on that. Great. Seems like it's a quiet group today. I don't think I'm seeing any questions.
I don't see any either.
Okay, great. So I want to move us into the part of the session today where we're really taking a hard look at how do we continue our time together during these sessions going forward. So we want to make some space on these webinars if it's a shared desire for providers to share how they're trying to create or trying creative solutions to implementing public health guidance and planning for recovery. So similar to what's been happening in some of the focus groups that DFSS has held, and also probably like what we're doing on the Thursday housing webinars, where we promote a lot of peer sharing that are facilitated by All Chicago. Thinking about going forward, these webinars that are on Fridays could include updates, like we've been doing, on the COVID-19 response and recovery as it's relevant to homeless service providers, but we could add presentations from peers on topics that are related to recovery and reopening. So if you could just use the chat box to just put some thoughts in there about whether these webinars would be, whether adding these peer sharing experiences to the webinars would be helpful for you, and if you have any other suggestions about how to make the webinars helpful, that would be great. It's really important to us that we're not just talking anymore. I think Maura and I are tired of hearing ourselves and probably each other talk about, some of these things, and so we also recognize that we're not the experts on the ground and really want to create a space where it could be beyond just us talking and sharing information. And we have a couple more slides, so this slide won't be the only place that we're asking kind of specific questions. We have a couple others, but I'm just going to pause for 1 minute and let people put some items in the chat. So, Andrew, to answer your question, the Thursday meeting is a peer sharing group for housing providers that All Chicago has been facilitating since almost the COVID-19 hit. And I think we probably can drop a link in the chat to where you can find more information about how to join that. Great. Okay, so keep putting ideas about, in particular this question was, would it be helpful to hear from other peer providers on this webinar? And if you are interested in sharing something yourself or want to hear about other things, this is kind of an extension of that question, so we'll just keep giving people a minute to put in the chat. Betsy, I love your question. So people can, I think, mostly see the chat, but Betsy asked, are there any opportunities at the COC level for advocacy for racial equity work as well as the COVID work? And the answer to that is yes. I think I was going to mention, but somehow forgot about it, so I apologize. But many of you know about this charge group that's meeting. I shouldn't call it this charge group, the charge group. I think it stands for Chicago Housing and Healthcare. I'm going to mess up somebody else can put it in the chat. I'm sure there's someone that can actually say it. But they are, there's so much power and excitement in that group, and we are trying really hard to figure out how do we bring the two groups together to sort of work on that issue and issues related to advocacy and in general together. So we have some calls with leadership both at the COC board level and with charge leadership to figure out what that looks like. And then I know that the other thing that I've been hearing just among the COC board level, and I think they'd be comfortable with me sharing this, but that we are not doing enough. And I think that's what everyone's feeling lately, is that no one's doing enough. But I think at the COC board meeting on June 17th, I would encourage the service providers and people with lived experience to reach out to your board members to say, is there a space to bring this up? So there will be an opportunity. We're going to have just a moment of silence and a moment for reflection at the start of the board meeting, and I'm hoping that from that comes some discussion about what this means for the continuum of care. All Chicago is thinking about it and prepared to sort of help take this wherever the continuum wants it to go, and we just need the board to get there as well. Okay, so a couple more questions, and these get a little bit more concrete. So we're going to ask you to use the chat box about these. So what is the right frequency for the Friday All Chicago and DFSS and CDPH webinars? So if you have an opinion, drop it in the chat box. And we just threw out a few ideas here: weekly, every 2 weeks, or other. What is the right frequency for these Friday webinars? Do you still want to have them weekly? Would you prefer moving them to every 2 weeks? Or would you prefer something else? And if you put other, please specify what you're thinking. Great. So keep putting in the chat what you think about this question, and we'll make sure to kind of tally the votes afterwards. Free conference call does not have a polling function, so we can't share results live, although it seems like every 2 weeks might have a leg up. We'll see. That's really helpful. Okay, so if we switch to the next question, going back to those Thursday afternoon webinars, because again, we want to make sure we're using everybody's time effectively, and we'll ask this question of the Thursday group too, but we host these peer sharing webinars for housing providers on Thursday, and these focus on practices, resources, and technical assistance. And we would love your thoughts about whether we should continue them the same as is, continue but change the focus, discontinue, or to combine with the Friday webinar. Ooh, Sherry, I love that idea. So for those of you that can't see the chat, Sherry suggested that the Thursday meeting should alternate with the Friday meeting. I think that's a great suggestion. Okay, and then if we didn't ask a question but you have something to say about the webinars, please feel free to just put whatever comments you have in the chat, and we'll leave the chat going. But I think, Maura, I think you're going to do this slide, and then I can wrap us up after that. I might have to go unmute her. Okay, Maura, are you there? Okay, yeah, I think I can just do this slide, and then we can see if there's any questions left for the group. So just as a reminder, we are going to continue these joint webinars at some level based on what we think the group is requiring, and we will post the presentations on All Chicago's Slack channel. And we just ask that you make sure that these communications are circulated to all relevant staff in your organization so they have the latest information. And then please keep DFSS informed about any staffing shortages, changes in bed availability, or suspected or confirmed COVID cases, or any other issues or concerns. You guys should all have this email by now, but it's on the screen for you in case you don't. And then just a reminder to join Slack. And one of the things I'm really interested in, and we'll get into this in the focus groups and in the survey that we send out, is how do we think about using Slack beyond the COVID era? I know we're not done with COVID, but we really feel like there has been some good engagement on Slack, and we've also know that historically with the COC implementation structure, people have largely felt like it's hard to know where to find information or how to find information or what decisions are being made where. And so we're just thinking about what are the right communication places to keep going. So we'll make sure to dive into that a little bit more later. But hopefully you found Slack to be a helpful resource, at least during this crisis period. I think that's a wrap, everyone. Thank you so much for joining, and we will be in touch about whether we're holding a webinar next week, just based on the feedback that we got from today's session. Take care.